So are there treatments then for some heart failure presentations in congenital heart disease?
Yeah, so let's imagine that we've done that work. We've actually addressed any residual anatomic problem. The question that we're all trying to answer right now is which of those guidelines, say from the latest European or North American guidelines, which of them apply to our patients with congenital heart disease? Look, I think the good news is if you're a patient that has basically a two ventricle circulation, you've got a left and a right heart, and the two sides are separated. I think that those, particularly with a left ventricle pumping blood to the brain and body, they're a patient that we can really apply the common guidelines to. So these days, we're looking at 4 classes of medications that we can use in those patients, aren't we? We're looking at the long-acting beta blockers. We're looking at the angiotensin receptor neprilysin inhibitors, ARBs and ACE inhibitors, mineralocorticoid antagonists, and we're looking at the SGLT2s. And we're going to choose those medications according to comorbidities, other diagnoses, and so on. If you're a patient with a systemic right ventricle, I think we're all still plugging away at what is the right medication. And I know that particularly in Europe, there's a lot of interest and enthusiasm for Entresto and the angiotensin receptor neprilysin inhibitors, and some really, promising small studies that suggest that they might be beneficial. I think that we start to have a different approach to people who are coming in with predominant classic right heart failure. I would say that most of those patients still have mechanical issues or rhythm issues that need to be prioritized. And then finally, it's those single ventricle patients. How do we help those? We haven't seen good evidence for the classic heart failure medications, but the trials are really small. I think if anything, we're probably more focused on things like phosphodiesterase inhibitors and endothelin receptor antagonists. I think there's more to come. I want to say for all of these groups, exercise is critical, cardiac rehab is critical, and I don't think we're doing a good enough job with our lifestyle advice and really helping our patients to optimize their health, including maintaining an optimal weight. Obesity, and I think obesity-related heart failure is a hidden issue in our population.
Thanks, Luke. And that was a really nice summary of, sometimes there's structural causes for heart failure presentations that an intervention might be helpful in, and other times, perhaps, like you say, medical therapy, which we have quite a lot of detail on this website if people want to go and look in a little bit more depth. But like you say, the importance of the things that we can all do a little bit better, which is probably exercise and those lifestyle issues, all help to optimize a person's kind of heart function, doesn't it?